Hello, everyone, and welcome to The Progressive Vibe. I am your host, Dodrick. Today's date is September 5th, 2021. This is Season 5, Episode 3. And today's title of this episode, Healthcare Expansion. So in today's show, we will be discussing potential healthcare expansion in the United States. We will be checking out an article by the Fiscal Times that reads, Democrats plot biggest healthcare expansion since Obamacare. So the key word I want everybody to pay attention to is plot. So we will be getting into depth more on the main show. So you guys want to stay tuned for that, because we're going to break that down. And obviously the listeners make the show, so I would hope you guys would stay around to listen and discuss amongst yourselves. Or, nice transition that we're about to lead into, you can do this right here. So if you have something that you want to say or discuss on the show, you can follow me on Twitter. That's Dottie_Vibe, DODI_VIBE. And you can use the hashtag TPVibe on Twitter. If you don't have a Twitter, you can send me a message from the contact form on the show's website. The show's website, theprogressivevibe184-970-366.wordpress.com. Again, that's if you want to say something about the show, if you have an idea or any type of topic, politically, that you want me to discuss on the podcast. Also, if you want to stay in touch with the show, that's to get every new episode that the Progressive Vibe makes delivered straight to your inbox. You can enter your email address in the stay in touch box on the show's website that I just gave you. All right, pretty cool. Last but not least, help us make the show, guys, and sustain future episodes. You can donate to the show by becoming a monthly supporter. We do have a few monthly supporters. It is greatly appreciated. Thank you so much. Hopefully, as time goes on, we will have more monthly supporters. But if you don't want to do that, you can make a contribution of your choice if you like. That is, again, it's all if you like to do that, guys. It's no commitment to do this. It's just a ask if you like. But you can make a contribution to the show's Cash App tag. Okay? If you have a Cash App, you can send your generous donations and to Dottie D92, that's DAHDEE 92. And again, this will help us sustain future episodes, and help us get other stuff to add on to the show. So again, if you want to become a monthly supporter, go to the show's website at theprogressivevibe184-970-366.wordpress.com. Last but not least, I want to thank the listeners of this podcast for liking, sharing, and donating to the show. However you show support, again, as I said, it is greatly appreciated, guys. As you know, sharing the podcast on social media is the most effective way to get the Progressive Vibe message out. And it's all totally free. The Progressive Vibe is on all platforms. You can listen and get your podcast. The Progressive Vibe is also now on Podchaser. If you guys don't know what Podchaser is or haven't checked it out yet, it is a platform that empowers podcast discovery for listeners, podcasters, and everyone else. So if you want to learn more about Podchaser, just go to podchaser.com. On that note, guys, let's get into today's main show, shall we? See you on the other side. Hey guys, welcome to the main show. So let's jump right into this, shall we? So, as I said, we have an article by the Fiscal Times. Democrats plot biggest healthcare expansion since Obamacare. Um, as we know, Obamacare helped a bunch of people, um, mainly people with pre-existing conditions, uh, more affordable healthcare. And that's super awesome. That's great. But it doesn't address the um, overall problem within the healthcare system. It's that, for one, healthcare is still tied down to um, your job, which shouldn't be a thing. It shouldn't. Again, we have to get out of this this complacency of, well, people that live in this country should earn this, should earn that. And in some cases it does, but we have to recognize that everything's not a privilege. Some things are just a fundamental right, and it should be a fundamental right in society. Um Fundamental right in society should be, people shouldn't be obligated to sleep on the streets. We shouldn't have homeless people, you know. And what we're talking about now to do with healthcare, uh, it should be a fundamental right for people to be provided healthcare coverage. Um, it shouldn't be dictated on what you can afford. Um, that's Healthcare should just be a fundamental right in this country. And obviously a bunch of things get in the way of that, which is the one main thing, which is money. Um, Big Pharma has a big grip on a lot of politicians in Congress, and whether they're a Democrat or a Republican, it's just certain things that they're not going to vote upon. And one thing that Democrats, so-called Democrats, um, are apparently opposing the reconciliation bill. Now we're about to get into what the reconciliation bill is and what it means. And this article I'm about to read is going to detail and put it in the caption of what I meant by that. But again, before I read this, I just kind of wanted to, because we're going to discuss after the read of the article, but I kind of just wanted to lay like a pre-drop down of what this can potentially mean. It can potentially mean we are going to be going into a universal healthcare. Uh, that's a long way away in my estimation, but uh, any start's better than none. And it seems like the things that they are reviewing to pass is significantly better than Obamacare. And it's things that's not included in it that should be included in it. You have to take what you can get when it's presented. Um, but at the same time, we're gonna have to call out the people who are um, don't have the American people's best interests, because again, majority of people in this country, regardless of Republican or Democrat, wants to see a more robust health care coverage for not only them but for their family, and which they should, because it should be a fundamental right. It shouldn't be a privilege. So, again, let's get into the breakdown of what the Democrats are plotting, as it says in this title. So it goes on to read: as Democrats get down to negotiating and writing their budget reconciliation bill, the Washington Post Rachel Rubin notes that the legislation is poised to be the biggest healthcare expansion since Obamacare. Rubin breaks down what's likely to be included in that expansion and adds that one major progressive policy change likely won't make the cut. That's a shocker. Anything to do with a progressive idea when it comes to the Democrats, it's just a no-go. It's just a no-go. But it goes on to read, here's an overview. Expanding Medicare coverage to include dental, vision, and hearing. This seems a foregone conclusion, Rubin says, but adding those benefits will likely take years. In the meantime, a Senate Democratic aide said the chamber is crafting a stopgap policy to help seniors afford these services right away. So essentially, they're saying that they're going to craft this new policy that it's not going to, this is not going to cover everyone now. This is not going to cover everyone, but we're going to craft it so it can help seniors afford the services that everyone else in this country is trying to get. And again, I'm so happy that they are crafting something to help someone, and particularly older people, because as we know, older people need more health care than younger people. But again, they Democrats act like when it comes to healthcare, they act like young people aren't going to turn into seniors either. They were young at one point and now they're old. I'm that kind of stuff kind of blows my mind in a way, because I'm like, okay, well, you're doing this for old people, and that's obviously a good thing. But why not go ahead and approve these other measures, these same measures for everyone else? But I do digress. I digress. I'm going to continue reading, guys. Um, it goes on to say expanding Medicaid in states that haven't done so under Obamacare. Democrats are working on a plan to extend Medicaid coverage to 2.2 million more adults via a federal plan for states that have resisted expanding the health care program for low income people under the Affordable Care Act. Under a leading option, Rubin reports, people would get free coverage on Obamacare's marketplaces for several years, given time for federal officials to create a new Medicaid like program providing more robust benefits, which is a good thing. It goes on to read, plans to lower prescription drug prices. Democrats have pushed to allow the federal government to negotiate prices with drug makers, but it's always a but. There are likely to be some differences between a plan passed by the House in 2019 and legislation being developed by Senate Finance Committee Chair Ron Wyden, Democrat from Oregon. The House bill tied Medicare drug negotiations to prices for selected drugs overseas, a plan that has faced pushback from moderates, Rubin writes. Instead, Wyden is eyeing a new route, tying price negotiations to a domestic benchmark, according to three lobbyists familiar with the discussion. Remember that, guys. Three lobbyists. The details of these and other drug pricing measures are going to be the subject of pretty fierce negotiations, one health policy lobbyist tells the Post. No reduction in Medicare eligibility age. President Biden and other key Democrats have endorsed the idea of lowering the Medicare eligibility age to 60, but the proposal isn't likely to make the cut. And that was the end of the article, guys. Obviously, I'm going to post this with the podcast, so you guys can read it if you like. But to me, let's discuss. So to me, what stuck out is the lobbyist. You know, what it's telling me is big pharma's dictating what's going on behind closed doors. They're going to dictate the age eligibility. As you see, as it said, President Biden and other key Democrats have endorsed the idea of lowering the age down to 60. But the proposal isn't likely to make the cut. So why isn't the proposal making the cut? It's because of big pharma. It's because there are politicians, and I'm speaking from the Democrat side. I'm speaking to the Democrat side here because the Democrats control the House, they control the Senate, and they control the White House. So they control all three branches of government. And that's why this is on them. It is people, it is key people within the Democratic Party who are not going to vote on the reconciliation bill or oppose it because it cuts into the pockets of big pharma. Thus, it takes away money from them. And that equals a corrupt politician because, again, the goal shouldn't be to line your pockets with money, with corporate interests. It should be serving the people's interest. And poll after poll says that the overwhelmingly majority of people in this country want universal health care, regardless of party affiliation. Regardless if you're a Democrat or Republican, you want health care, Medicare for all. And you have these so-called moderate Democrats within the party who don't want that. So what we're going to do is we're going to take a quick break, and when we come back, we're already at the 15-minute mark, guys. We got to take a break. I'm going to give you detail on the reconciliation bill, to make sure that everyone has a clear understanding of what it is, who's the chair, what it means, how many votes you have to have. We will be discussing that and the breakdown more of the article when we come back. Hey guys, we're back from the break. Time sure does fly when you are ranting like I do. But let's get back to this. So, as I said before we took our break, more information concerning the reconciliation bill. So, again, if you guys um, don't know what reconciliation is, let me provide a little context to the reconciliation process. So, the chair of the budget committee, who is Bernie Sanders, can go in and pass a bill with only 50, well, technically a 51 vote margin, which means you have to have every single party member, which in this case are the Democrats, to be on board, including the VP Kamala Harris, to be that 51st tie-breaking vote. You can only do reconciliation 3 times per session. So basically, it ties up infrastructure with the budget process. Excuse me. But again, as I was saying in the first part of the show, there are Democrats within the party that aren't on board with this. Um, you know, and why? In my opinion, it is because it's taking away money and it's affecting big pharma companies. That's just how I see it. Um, I think it's affecting or can potentially affect, which is again take money away from big pharmaceutical companies. Um, and why would these politicians hate the idea of that? Well, because a lot of these politicians are corrupt. They have other interests that are not in the best interest of the American people. Just simple as that. Um, Big Pharma pretty much tells them how to vote on legislation to do with, you guessed it, Big Pharma. They tell them what and how to vote on things to do with big pharmaceutical companies. It's just as simple as that. They pay them money to not vote on things to help everyday average people, working people in this country. It's just that simple. Um, so again, there are Democrats saying effectively, no, I don't want to lower prices of prescription drugs for people because that's going to take away um it's going to take away more money. away from us, and we don't like that. Even though we are a multi-billion-dollar pharmaceutical company, and I don't know the names, obviously, of every pharmaceutical company here in the United States. That's why I just group them all together because they all have the same. Um, they all have the same standard, and that is to make as much money as they can by selling uh, prescription drugs to people. They don't do it because you know it's just the right thing to do. If it was just the right thing to do, then it would be, well, we don't want this elderly person to get sick and die. And we have medication that will help prevent their sickness or help cure whatever's going on with that individual. But first, we rather to capitalize on the system within the United States that allows us to uh, make money off sick people. That's pretty much how it boils down to. And they're going to keep doing it until it's legislation put in place to keep them from doing that. But if you have majority of politicians who are in power who dictate these things saying, well, we don't want to touch these things like making healthcare more affordable. We damn sure don't want to make it universal because we have interest within Big Pharma and they pay us enough money not to do these things. And that's what happens. That's literally what happens. Um, but I do believe the biggest reason, in my estimation, that so-called moderate Democrats oppose the reconciliation bill in its totality is because they simply don't want any movement away from fossil fuels. And Big Pharma does play a big role in it, but the oil industry also plays a big part within the um, up, with the reconciliation bill. And I know this episode particularly is about healthcare, but if we're going to tie in Big Pharma and how they have a grip on, uh, government behind the scenes, then we also have to throw in the oil industry because they have just as big of a grasp on politicians in Congress than Big Pharma does. And I certainly believe that Democrats would be way more persuadable on bending to the woes produced by Big Pharma than any type of movement concerning the environmental disadvantages due to the fossil fuel industry. Um, that's just my take on it. Um, they really don't want to have any type of regulations concerning fossil fuels because, quite frankly, the so-called and it just kills me that you know they hide behind this moderate thing. Democrats that oppose um, structurally benefiting people's lives can vote on legislation that can structurally benefit the lives of everyday average working people. Um, the reason that they don't want to do it is because again, um, they have other interests. They just have other interests that has nothing beneficial to do with again, the average everyday people who they always say that they are supporting or got to do better in supporting. But again, behind the scenes, you're opposing legislation like the reconciliation bill that can do the thing that you claim that you want to do. But we know once, it's easy to talk the talk, but when it's time to walk the walk, are enough of these politicians going to say, you know what, I'm done taking corporate lobbyist money or corporate PAC money. And 9 times out of 10, they're not, because a lot of these corporate PACs fund their campaigns. It's almost like signing your soul, to the devil, as they say, quite, you know, quite annoying stuff, because it's very, very annoying that we have so many corrupt politicians within government, and all it does is just make people not want to be involved in the political process, because they say one thing, and when it's time to do the right thing, they never do it. But before we end this segment, I do want you to listen to this short clip produced by the Ring of Fire, Farron Cousins. If you haven't heard of his commentary, you should definitely give him a check out. It's called, again, The Ring of Fire. You can check it out on YouTube. I listen to it and watch it all the time. But Farron Cousins names the so-called moderate Democrats who are obstructing the passage of the reconciliation bill. So check this out, guys. Give us a quick listen, and we'll come right back.
Democrats, it's moderate, what you'd call moderate Democrats, but some of them have not been characterized as moderate in the past.
Right, and let's name one here. We got Gonheimer, Bordeaux, Case, Costa, Kuehler, Golden, Gonzalez, Schrader, Vila, and of course you have the U.S. Chamber of Commerce right now running ads complimenting and praising all 9 of these Democrats. This, by the way, was put together by David Sirota over at Jacobin, and he's wonderful. I love what he does.
This report by Sirota in Jacobin magazine is excellent. Let's put the names of those folks up there, and let's let the American public see who's messing with them. These are the folks.
Yeah, and this is a must-pass piece of legislation. Yeah. It gives the public something real, some real benefits to their daily lives. You can't have these big interests come in and try to kill them.
Big pharma, big oil, always in charge of our lives. No difference here. Farron, thank you for joining us, okay?
Thank you.
So, again, that was Farron Cousins talking about the non-Democrats who are obstructing and refusing to not refusing to vote on the legislation, but refusing to pass it. So they're going to vote no, apparently. And like Farron said, we can't allow these corporations, these institutions like this to dictate people's, interest, the everyday people's interest, because we want these things, and they're not one to vote on these things, even though the party itself is wanting to pass the reconciliation bill. It's some Democrats who call themselves Democrats who outright oppose it because their interest lies somewhere else. And it's important to know the names of Congress members who work against the American people's best interest. And just for the record, before we end this segment, I'm not telling people what interests are best for them. I just look at the data. I see what the American people are most concerned about, what they want, for them, and it speaks for itself. The data speaks for itself. But guys, that's going to end this segment. When we come back, we are going to have the social media break. You don't want to miss that. Stay tuned, and we will be right back. Hey guys, welcome back to the show. This is the social media break of the program, so I hope you do enjoy. This is by Biggs Burke, but it was retweeted by someone who I follow on Twitter. Repostful and Relatable Podcast. By the way, check that podcast out. It's just like the title of the podcast says. Super relatable, and it's just awesome podcast in general. But he retweeted Biggs Burke, who said, "Fake has become so acceptable that people get offended when you keep it real." And that's so true. We've just gotten so far away from just being honest, that it's so sad to see in so many different ways and aspects. It's so much that it's pretty overbearing, honestly, especially when it's concerning politics, because this podcast is all about trying to share researched information and to give you guys the truth, and to be as real as possible. We try to keep it as real as possible on this show. And some people don't like that. They like being told things that they want to hear, even if it's a lie. And I refuse to live in that alternate reality, because we have an actual reality to worry about and to get right. And I still believe we can get it right. Everything takes time, but you have to keep hope alive, and you have to believe, and you have to rely on the truth, because if you don't have the truth, then what do you have? You have a lie. And I refuse to live my life as a lie, even if that lie is more acceptable than the truth. I always would rather have the truth, even if it hurts. That's just me. But very good point by Biggs Burke there. Scrolling on down here, Dr. Tina Ellsworth says on Twitter, other ways to prevent abortion: vasectomies, free birth control, sex education, expanding Medicaid to help single parents. Yet you don't want any of those. So you're not really about stopping abortion after all, are you? I'm gonna just let that tweet speak for itself. And I will say, me being a guy, that we as men who listen to this podcast, we have no right to say or dictate what a woman does to her body. That's just my personal belief. That's what I think is the right thing. We don't have no one telling men what they can do and not do with their bodies, because I feel like in this society we are more accepting of things men can do that women can't do. Obviously, it's a lot of history that points that out. But again, I'm uncomfortable to do a whole show based on abortion because I see it as just what I just said it was, and that's letting women decide what they wanted to do with their bodies. Now, obviously, everything has a process of how you do it and how you go by doing that, just like everything else in this country that has regulations. But you can't have, and it's predominantly white men who are in positions of power within the government in these states, particularly Texas, telling women what they can do and not do with their bodies. And let's move on, shall we? One more, guys, and we are going to end this social media segment. Andrew Lawrence says on Twitter, I retweeted this, says Virginia Tech requires their students to be vaccinated. I know it's weird seeing large groups of people together right now, but let's lay off the kids who are doing what we told them to do to get back to normal. I agree with this. Because when I first seen it, I was like, man, this is a lot of folks that don't have on mask, and I'm sure that, you know, some people out there can't be vaccinated, right? But I did do some research, and it turns out that everybody in that Virginia Tech crowd was vaccinated, and that's good on them. And it's good to see things, at least on television, looking back to normal. I'm a big college football fan. I'm a big sports guy. And I've been to plenty of Alabama games, and I've been in the crowd, and I love the atmosphere and the adrenaline rush, and I enjoy, watching football. And I am also aware that it is a pandemic going on, and I would recommend people, again, as I said in past episodes, that I recommend people, get vaccinated, and wear your mask. In this case, everybody in the crowd was vaccinated. Nobody didn't have on a mask. That's fine. Everybody's vaccinated. And hey, let the kids have some fun. So I'm all with it. But that's going to do it for the social media break, guys. Hope you guys enjoyed. When we come back, we will close out the show. Stay tuned, and we will be right back. Hey guys, that's going to do it for today's show on The Progressive Vibe. I hope everyone enjoyed the listen. I always love breaking down the news in a progressive manner with you guys. Hope I was able to shine a light on some aspects of healthcare and the potential expansion of it, and the reconciliation bill. There's going to be more to come, obviously, with the reconciliation bill, with the potential expansion of healthcare coverage. There's breaking news pretty much every day at this point. So we will continue every week to provide you the progressive insight on politics, the news within the week. And I want to reiterate what I said in the intro. I appreciate all the listeners for continue to tune in every week, to like the podcast, to share it, to donate. I appreciate all that, guys. Our base is continuing to grow. I want to thank the listeners for spreading the word, because this is a social media driven society that we live in, and so by doing that, it is able to our message is able to carry out there in the technical world. But I really do appreciate you guys. Love you guys. I hope everyone continue to stay safe out there. It is a pandemic still going on. So if you haven't gotten vaccinated, I'm not a doctor, but based on the data and the stories and the research that I've seen on it, and it's a lot of people that aren't here today due to dying of COVID. So it's a very serious thing, guys. Continue to take precaution. And we will be back next Sunday with a brand new episode on The Progressive Vibe. But until then, you know what time it is. Stay positive, stay progressive, and we will see you guys in the next one. Love you. Peace out.